Hello everybody, my name is Dr. Eric Miller. I'm with Chiro-Med Health and Wellness Centers in Orland Park, Illinois. Today's topic is about sciatica. Sciatica is a condition in which the patient presents with generally lower back pain and pain in the leg. Typically, the pain in the leg is produced by an actual pinch of the sciatic nerve. The most important thing if you're having leg pain is to get a proper diagnosis. Is it really sciatica? Is it, a blood clot? You need to see a physician for that. So make sure that you get to a physician that knows musculoskeletal and nerve-related conditions, like a chiropractic physician or a physiatrist or an orthopedic neurologist, somebody that deals with that regularly. The sciatica needs to be completely diagnose what's actually causing it. Is it muscular? Is it just inflammation from joint? Is it hard tissue like bone that's putting pressure on it? And can it be removed? Can we take the stress off the nerve so the nerve can function like it should and eliminate the symptoms like the burning, cramping, numbness, tingling, pain in the leg that comes along with sciatica? All right, I'm going to use my assistant Morgan, who's also my daughter, to basically run through a normal examination, keep it simple, nice and short, examination for a typical sciatica patient. So Morgan's going to represent a patient that came in complaining of lower back pain, pain that goes down through the buttocks and again goes down into the leg. One of the first things that we want to do is we want to check out the leg visually to make sure that she doesn't have any problem with swelling, bruising, heat, anything that would represent a vascular issue or a blood clot or something in the leg that might be causing the issue. So we're basically just going to pull up the leg, take a look at it, see what's going on, look at the ankle, make sure the foot and ankle are not swollen, and that's not the case, and then also check out the actual calf. You can do some pressure on the calf, this is called Homan sign, to see if there's any swelling or any heat in the calf, and if there's a blood clot there, you're probably going to see some swelling through the calf, you're going to see some swelling over the top of the foot, and it'll probably hurt when you actually squeeze the calf. After we have visually inspect the legs, make sure that everything's cool with that, then we're going to go through some real simple orthopedic examinations. So first thing I'm going to do is have Morgan stand up. I want you to face that way, Morgan. And I want you to bend at the waist to touch your toes. So we're going to check the lumbar range of motion. Go ahead and bend over, touch your toes. She's doing really great with that. The average patient with sciatica will probably have a problem with that because this is going to create traction through the nerve as she bends over and flexes that area. Come on up. Now I want you to go into full extension. This is another place where the nerve could be pinched when you extend the vertebrae over each other. Very good. I want you to rotate as far as you can rotate from one side. Fantastic. To the other side. Fantastic. Good. Now I want you to lateral bend from one side to the other side. Lateral bend to the left. Very good. To the right. Very good. Fantastic. If a patient's having problems with a nerve pinch, generally when they bend to the affected side, that can pinch the nerve even more. That's a sign that you're on the right track and you're going to have to identify what particular level is being pinched. Let me have you sit on the edge of that table for me real quick. We can check reflexes also, just to make sure that there's not a reflex change that would demonstrate severe pinching of the nerve as well. So we can check out the patellar knee reflex. And there should be a little kick with that. We can check Achilles reflex.
Because the doctor wanted to give me the extra visits if I
Now that's going to check L4 nerve. The Achilles will check the S1 nerve. If there's a problem with the pinch there, you're going to find hyporeflexia or a decreased reflex, or you can find an increased reflex. Everything was great with Morgan, so we don't have to worry about that, but that's something that you should check. Now we also check strength. So I want to make sure that the leg strength is the same from side to side and it's full strength. If you have a pinched nerve, sometimes you can create weakness in the leg. So what I'll do first is have the patient push out against me to check the thigh muscles. Push out. Good. That's great. A +5. Push out. Good. Nice and strong. Now I want you to pull in. Nice and strong. Pull in. Nice and strong. Okay, now we also want to check dorsiflexion and plantar flexion, which is a sign of L5 weakness if you can't hold it up when I'm pushing down, or S1 weakness if you can't step on the gas, so to speak. So push that up as hard as you can, and don't let me push it down. Good. Same thing here. Good. And push down. Good. And push down. Good. If there's a problem with the pinched nerve, there can be weakness in one side or the other. And then again, we have to identify what's going on with that. Let me have you lie on your stomach.
Thank you. Bye-bye.
Again, the three components of sciatica, or the three possible problems that cause sciatica: inflammation, soft tissue irritation, or hard tissue, can be ruled out with examination. Typically, the patient is going to present with maybe some swelling in the lumbar spine, maybe some swelling over sacroiliac, maybe muscle tension in the piriformis muscle or gluteus, maybe even hamstring tension that goes along the back of the thigh, maybe even tension through the calf muscle. So when you examine, you're going to palpate and basically find out if there's any problems with motion through the segments, if there's any change in muscular tension from side to side. If this patient, or if we're going to happen to have a problem with the piriformis muscle that was causing sciatica, I'd end up finding a muscular tension right at that piriformis muscle. And when I would poke on it, the patient would generally let you know that's a hot spot, it's creating pain there, there's inflammation, there's spasm in that muscle, and it may even light up that nerve as we put pressure here, like you're shorting it out almost. Let's just pretend that we've got a sciatic nerve problem caused from the piriformis syndrome. What I want to do with that is I want to basically work on doing some muscle work with that piriformis muscle and gluteus. I may even refer to my massage therapist to have them work on that for up to an hour, but I'm also going to do some stretching for it. Let me have you roll over onto your back for me. A great stretch for piriformis is basically taking the leg up into flexion, bringing the knee across the body. Can you see that from there? And then bringing the knee towards the opposite shoulder. That's going to create stretch through the hamstring, through the piriformis, and through the glute. So butt, hip, and thigh, basically. And then have the patient push out, and then relax. We're going to use to stretch that muscle a little bit. That's good. Okay. Let me have you roll back over onto your stomach for me. So that's a good stretch for that particular area. Of course, we do it a little bit more, but just for video's sake, we're going to shorten it up for you. We're also going to address, again, the joint movement to decide if we've got any issues with misalignment or joint fixation that are causing the inflammation that's getting onto the nerve going down into the sciatic nerve. So we're going to say that we've got an issue with the L5 vertebrae, and we're going to move that today with some manipulation. Let me have you turn over on your side, this side up. Again, a simple joint manipulation is going to work really well with this. If you saw my last video, we talked about sacroiliac, and we demonstrated a lumbar adjustment, lumbosacral adjustment, sacroiliac adjustment for that. We're going to do basically the same thing. We're going to put the patient into a position to gap that joint. The doc will lean over, drop right down through that, open up that joint, cavitate the joint, basically move that joint, and that's going to help to disperse some of the inflammation, get that joint moving again so that you can kind of change the way the muscle is acting around that area. How'd that feel?
Felt good.
Good. Another thing we do with sciatica is we do a long axis traction. So we'll actually pull the leg, just like old school traction, without all the traction device, just using your body and kind of laying into it, pulling the hip, pulling the spine, trying to make more space for the nerve to come out of the spine. And of course, we're going to stretch the hamstrings as well. I'm going to go ahead and stretch this hamstring just for demonstration purposes so you can see how it's performed. So we'll put the leg up on the shoulder, and we'll basically try to get that leg up to a 90-degree angle. The patient's going to feel this through the hamstring. If the patient has pain coming down the leg when you're doing a stretch like this, that's an orthopedic test called SLR, straight leg raise. So if you're bringing the leg up like this and the patient's going, oh, it's going down my leg, or I've got pain in the back, that's a positive orthopedic finding. If you bring it up a little bit more and it starts to go down the leg more, that's positive for pain production due to nerve pinch. Another thing that you can do is check by doing what's called a Braggart's maneuver, by dorsiflexing the foot a little bit. If that hurts more, again, you're going to create more traction through the nerve by doing that, indicative of sciatica. So stretching the hamstring, stretching the calf, another way to stretch the calf would be just to get it to about a 90-degree angle, pull the foot down. This is a really good stretch for the calf muscle itself. Push up and relax, and push up and relax. Good. So we've got the stretch on the calf, we've got the stretch on the hamstring, stretch on the glutes. So basically all the muscles that are along that path of that sciatic nerve, you need to check them and stretch them if they need to be stretched. That's about it. If you get the manipulation, if you get the muscle stretch, if you handle the inflammation component of it, as long as it's not, a lot of arthritic change that it's going to take much longer to accomplish your goals with that, just because it's degenerative, things should respond very quickly. I hope this information's, really helpful for you. If you have sciatica, feel free to contact us anytime. Our phone number is 708-403-2727. Take care.